So during this lesson, we're going to talk about psychoanalysis and psychodynamic therapies. So through the course of this small lesson, I hope that I can help answer the following very long question for you. What are the goals and techniques of psychoanalysis, and how have they been adapted in the psychodynamic therapy? So first, let's talk again a little bit about the history of treatments for psychological disorders. These include a mix of really harsh and gentle methods. Would-be healers have cut holes in people's heads and restrained blood or beat the devil out of them. They've given them drugs and electric shocks, but they also have given people warm baths, massages, and placed them in sunny, serene settings. They have talked with them about their experiences, feelings, thoughts, and behaviors. So the switch from harsh to gentler methods arrived because 19th century reformers such as Dorothea Dix and Philippe Pinel, they both pushed for more humane treatments and for constructing mental hospitals. Most of those hospitals now have other uses. Since the 1950s, effective drug therapies have been available, and community-based treatment programs are now common. Dorothea Dix once said, "I call your attention to the state of the insane persons confined with this commonwealth in cages." And then also throughout history we have places that we have paintings of Philippe Pinel visiting people and trying to take people out of the cages and trying to help them become involved in more humane treatment for these patients. Okay, so today's therapies can be classified into these two main therapies. So we have psychotherapy. Psychotherapy involves a trained therapist uses psychological techniques to assist someone in seeking to overcome difficulties or achieve their personal growth. So this one involves a therapist. There's also biomedical therapies, and these offer medications and other biological treatments. So during this lesson, we will be covering the first part of the psychotherapies. We're going to move on to the biomedical at the end of the therapies, the PowerPoints and lessons on the therapies. Okay, so I wanted to talk a minute about the eclectic approach. So the eclectic approach, like a buffet, it's a smorgasbord of all of the therapies combined. And this is the most popular form of therapy. It's basically all of these different techniques from the different schools of psychology. And so a therapist will take little bits and pieces from all of these different approaches or techniques and combine them together to help treat a patient of their psychological disorder. Okay, so we need to talk a little bit about Sigmund Freud again. We've heard a lot about him. So he's considered the father of psychoanalysis. The first major psychological therapy was his psychoanalysis that he created. It's his creation. Although few clinicians today actually practice therapy just as Freud did, his work deserves discussion. It kind of helped form the foundation for treating psychological disorders, partly by influencing modern therapists working from the psychodynamic perspective. So Freud believed that people could achieve healthier, less anxious living by releasing the energy that they had previously devoted to the id, ego, superego conflicts that they had within themselves. So the patients participated in 3 associations: resistance, dreams, and transferences, and we'll talk about most of these later in this lesson. And an analyst in performing this psychoanalysis interprets them and releases the previously lets the patients release these previously repressed feelings that they kept hidden inside, and this hopefully allows the patient to gain a self-insight or understand their issues a little bit better. Okay, so there are several goals of psychoanalysis. Okay, so one of the goals of psychoanalysis is to to access a patient's unconscious mind. That is really one of the main goals of psychoanalysis. So Freud wanted to bring the patient's repressed feelings into the conscious awareness by helping them reclaim their unconscious thoughts and feelings. Okay, so psychodynamic theory emphasizes the power of childhood experiences to mold us. So because of this, its main method is historical reconstruction, or taking past experiences and putting them back together to try to come up with what the problem is, okay? So it aims to kind of excavate the past in hope of loosening its bonds in the present. Many people of his generation, including Freud, they began with hypnosis as a method of discarding and trying to get these unconscious feelings, but he ended up not using it anymore because he thought that it was unreliable, and instead he turned to other techniques. So the techniques that Freud typically used were free association and dream analysis. So imagine yourself as a patient, or perhaps with maybe a trusted friend, doing free association. With free association, it's something like this. First, you relax. You may lie on a couch or sit in a comfy chair. As the psychoanalyst sits out of your line of vision, so you don't see them, they don't see you, so you can say whatever you want and not feel like you're being judged. You say aloud whatever comes to your mind. At one moment, you're relating a childhood memory. At another, you are describing a dream or recent experience. It sounds easy, but soon you notice how often we edit our thoughts as you speak. You pause for a second before describing how embarrassed you feel giving a class presentation. You leave out details that seem trivial or shameful. Your mind goes blank as you try to remember an important person or place. You may even joke or change the subject to something less threatening. This is kind of how it works with psychoanalysis, and with free association in particular. So the free association, it really deals with the patient saying whatever comes to their mind, no matter how strange, weird, random, disconnected it is with anything else, just whatever comes to their mind. And the analyst will interpret that as being something that they are drawing out of their unconscious. And then the dream analysis is similar in that the patient will relate a dream in as much detail as possible to the analyst. And so they're able to, the therapist can analyze the dream, and believing that dreams are a piece of our unconscious, pieces of our unconscious that we keep repressed, but they come out when we are sleeping. That's kind of the idea. And so in interpreting the dream, the analyst will get an idea of maybe perhaps what's on your mind and what's bothering you and what's causing issues. Okay, so we need to talk about resistance, which is blocking anxiety-laden material from the conscious. Okay, so to an analyst, these little mental blips that we kind of don't show that are blocks, they indicate resistance. They are a hint that anxiety lurks and you are defending against sensitive material. The analyst will note your resistance and then provide insight into this meaning. Okay, and so the next thing it brings us to is the interpretation, which is the analyst noting supposed dream meanings, resistance, and other significant behaviors and events in order to promote insight or promote an understanding of what the underlying problem is in our unconscious. So the resistance is kind of our tendency to block these things and not want to talk about them. Okay, so with the resistance, if offered at the right moment, this interpretation that the analyst may have, or say you're not wanting to talk about your mother or call or text or message her, it may reveal an underlying wishes, feelings, and conflicts that you're avoiding. The analyst may also offer an explanation on how this resistance fits with other pieces of your psychological puzzle, including those based on an analysis of your dreams. Okay, so transference. If you multiply the one session by dozens, and your relationship patterns will surface in your interactions as you are with the therapist. You may find that you have a strong or positive or negative feelings for your analyst. The analyst may suggest that you are transferring feelings such as dependency or mingled love and anger that you experienced in earlier relationships with family members or other people that were important to you. And by exposing such feelings, you may gain insight into your current relationships. Relatively few U.S. therapists now offer traditional psychoanalysis. Much of its underlying theory is not supported by scientific research. Analysts' interpretations cannot be proven or disproven, and psychoanalysis takes a lot of time and money, often years of several expensive sessions a week. And some of these problems may have been addressed in modern psychodynamic perspective, as it has evolved from psychoanalysis, which we're going to be talking about next. But transference, as far as that goes, it's pretty much the patient transferring to the analyst emotions linked with other relationships, whether it's anger from other relationships. They could be angry at their analyst, or they could start thinking of them as a parent figure or a love interest. Okay, so next let's talk about the psychodynamic therapy. Okay, so this is a therapeutic approach derived from the psychoanalytic tradition, which comes from the from Freud's psychoanalysis. Okay, so this views individuals as responding to unconscious forces and childhood experiences, and it tries to seek to enhance the way that the patient sees it, or self-insight. Okay, and so with psychodynamic therapy, those using the psychodynamic therapy technique also aim to dig up their client's past, but they don't talk much about the id, ego, and superego. Instead, they focus on themes across important relationships, including childhood experiences and the therapist relationship. They try to help someone understand their current symptoms, such as we can have loving feelings and hateful feelings towards the same person, and we can desire something and also fear it. Noted psychodynamic therapist Jonathan Shedler, client therapist meetings take place once or twice a week rather than several times weekly. For only a few weeks or months rather than for several years with psychoanalysis, it's a long process. And rather than lying on a couch out of the therapist's line of vision, which happens in psychoanalysis where the patient doesn't see the therapist, the clients will meet with their therapist face to face. Okay, so that's the main differences between that. So now we have a face-to-face therapy with the psychodynamic therapy, the approach. And this is when in these meetings the clients will explore and gain perspective on defended against thoughts and feelings, and they will do it with the patients face to face to gain a better perspective on hidden or defended thoughts and feelings, and that's kind of creating more of an interaction instead of just the patient just kind of saying whatever comes to their mind. They're going to have more of an interaction with the therapist, kind of a heart-to-heart talk about what's going on.